I'd like to begin by showing what we're talking about. This happens to be a training device.
This trainer contains no needle or drug.
Tells you that. It tells you to pull this out.
Inject. Place black end against outer thigh. Then press.
You pop it down, it starts counting down.
3, 2, 1.
And that's it. That is what happens when you use an auto-injector. 5 seconds to save a life. And I think we all agree that keeping children safe is one of our government's most basic duties, particularly our obligations to parents while our children are at school. We have a new health epidemic in schools which warrants our attention to that obligation, which are life-threatening allergies. According to the sponsor of my measure, the Food Allergy Research Education, or FAIR organization, as many as 15 million children suffer from life-threatening allergies. It's estimated that nearly 6 million of these people are children under the age of 18, which translates to 2 in every classroom. Approximately 25% of first-time allergic reactions that require epinephrine happen at school. Recently, this issue even drew the attention of President Obama, who signed a federal law which states who require stock epinephrine in schools may receive preferential treatment in the awarding of certain grants, such as H.R. 204, School Access to Emergency Epinephrine Act. He also noted his own daughter has a peanut allergy. Given this new incentive from the feds and the prevalence of life-threatening allergies today, an increase of 50% from 1997 to 2011, according to the CDC, it's necessary that California revisit this issue. My bill, SB 1266, will require extra epinephrine injectors to be stocked at schools. Current California law allows schools to stock epinephrine, but has not required it, putting some students at risk and making California potentially ineligible for this federal incentive. Anaphylaxis is a potentially lethal allergic reaction, and the numbers of children with this condition are skyrocketing. It can happen when a person's stung by a bee or ingests foods such as shellfish or nuts, or maybe even just comes in contact with something as simple as latex. Reactions can be so severe, even fatal, that without proper use, without prompt use of epinephrine, they can die. Just on my Southwest flight coming up here this week, they handed out pretzels instead of peanuts because someone on board had an allergy to peanuts. Epinephrine, or what we commonly refer to as adrenaline, epinephrine is the first line of treatment for someone who's experiencing anaphylaxis. It can be easily administered, as I just demonstrated, has very little side effect. Current law requires prescription for epinephrine to be made to a specific student in order for the medication to be stored at school so it can be used in case of an anaphylactic reaction during school hours. SB 1266 will require extra epinephrine injectors be prescribed as a standing order, so epinephrine can be on hand in all public schools. By ensuring schools' emergency medication is available at schools, we can be sure that all students with allergies are safe at school, even when they don't know they have an allergy. By requiring stock epinephrine, as described in my bill, SB 1266, we're enabling our state to compete for federal dollars and provide our school health professionals the necessary tools and peace of mind to keep children safe.